Breast cancer, risk factors, early signs, and prevention. Breast cancer happens when cells in the breast grow out of control. These cells form a tumor that can be felt as a lump. But not all lumps are cancer. Many lumps are harmless. Breast cancer is very common. 1 in 7 women will get breast cancer in their lifetime. But here's some good news. When doctors find breast cancer early, the survival rate is 99%. Being a woman is the biggest risk factor for breast cancer. But men can get it too. The risk is much lower though, only 1 in 556 men. 1. Age is also very important. Most breast cancers happen in women over 50 years old. About 75% of all breast cancers occur in women over the age of 50. The average age when women get diagnosed is 61 years old. 2. If you have a family history of breast cancer, your risk may be higher. But most women with breast cancer have no family history of the disease. Some risks you cannot change. These include getting older and being born female. Some women inherit gene changes like BRCA1 and BRCA2. These genes greatly increase breast cancer risk. But only about 5% of breast cancers are caused by these inherited genes. 3. Dense breast tissue also increases risk. Dense breasts have more fibrous tissue and less fatty tissue. This makes it harder to see tumors on mammograms. 4. If you started your periods before age 12, your risk is higher. 5. If you went through menopause after age 55. This is because these situations expose you to hormones for longer periods. The good news is that about 25% of breast cancers could be prevented through healthy lifestyle choices. Here are the main things you can control. 1. Weight control. Being overweight or obese increases breast cancer risk, especially after menopause. This is because fatty tissue produces estrogen, which can fuel some breast cancers. Keeping a healthy weight throughout your life is important. 2. Physical activity. Exercise is one of the best things you can do. Women who are physically active have about 13% lower risk of breast cancer after menopause. Even moderate activity like brisk walking helps. Try to get at least 150 minutes of moderate exercise per week. Wait, there is more, but do not forget to hit the like button if you think this video is useful. 3. Alcohol. Drinking alcohol increases breast cancer risk. Even small amounts can raise your risk. The more you drink, the higher your risk becomes. If you choose to drink, limit it to no more than 1 drink per day. 4. Smoking. While the link isn't completely clear, smoking may increase breast cancer risk. Tobacco smoke contains over 70 chemicals that cause cancer. Quitting smoking is always good for your health. 5. Breastfeeding lowers breast cancer risk. The longer you breastfeed, the more protection you get. If you're able to breastfeed, try to do it for at least 12 months. 6. Having children reduces breast cancer risk. The risk decreases by 7% for each child you have. Women who have their first child after age 30 have a slightly higher risk. 7. Knowing the early signs is very important. Many women have no symptoms at all. That's why screening is so important. But here are signs to watch for. 8. The most common sign is a new lump in your breast or armpit. Hard lumps with irregular edges are more likely to be cancerous. But soft lumps can be cancer too. 9. Other signs include changes in breast size or shape. Your nipple might pull inward or develop a rash. You might notice nipple discharge that isn't breast milk. This could be clear, bloody, or another color. 10. Watch for skin changes too. The skin might look dimpled like an orange peel. There might be redness or swelling. Some women notice unusual pain in their breast or armpit that doesn't go away. Remember, most breast lumps are not cancerous. But if you notice any changes, see your doctor right away. Don't wait. Think of your family, children, and partner. Don't go for alternative treatments without proper proven research. Early detection saves lives. Screening means checking for cancer before you have symptoms. For breast cancer, this means mammograms. A mammogram is a low-dose X-ray of your breasts. Mammograms can find breast cancer as small as a grain of rice. That's much smaller than what you can feel with your hands. Finding cancer early means better treatment options and higher survival rates. In Australia, women aged 50 to 74 get free mammograms every 2 years. Women aged 40 to 49 and over 75 can also get free mammograms if they choose. The screening program has been very successful. For women aged 50 to 74, the breast cancer death rate has dropped by almost half since the program began. Women diagnosed through screening have a 69% lower risk of dying from breast cancer. While there's no single food that prevents breast cancer, healthy eating helps overall. Eat plenty of vegetables and fruits. Choose whole grains over refined grains. Eat good fats like olive oil, canola oil, and nuts. Coconut is not a nut. Limit red meat and processed meats. Choose fish, lentils, soybeans, or other beans for protein instead. Avoid sugary drinks and highly processed foods. Some research suggests that dairy products might help reduce breast cancer risk. Eating lots of vegetables may also be protective. Eating a variety of vegetables and fruits every day works to lower your risk of getting most types of cancer. Here are the vegetables and fruits that research suggests offer the most protection. Cruciferous vegetables includes broccoli, cauliflower, cabbage, Brussels sprouts, kale, and bok choy. These are well known for their cancer-fighting nutrients like sulforaphane and indoles. They help protect cells, reduce inflammation, and may stop the growth of cancer cells. Leafy green vegetables, spinach, lettuce, silver beet, and others. They are high in vitamins, fiber, and antioxidants. Carrots. Rich in beta-carotene and other antioxidants, carrots may help slow the growth of cancer cells and protect against cancers of the mouth, esophagus, and stomach. Tomatoes. A good source of lycopene, which helps protect cells from damage. Onion and garlic family. Includes onion, garlic, leeks, and chives. These allium vegetables contain natural compounds that may fight cancer. Cancer-protective fruits. Berries. Blueberries, strawberries, raspberries, and blackberries are loaded with antioxidants like anthocyanins and vitamin C. These may slow cancer cell growth and help protect DNA. Citrus fruits. Oranges, lemons, grapefruits, and limes are rich in vitamin C and may help lower the risk of different cancers, including mouth and digestive cancers. Apples and pears contain fiber, vitamin C, and antioxidants like quercetin, which may help block the growth of cancer cells, especially in the lungs and digestive system. Cherries have antioxidants that studies suggest may help decrease tumor growth in some cases. Other colorful fruits, such as grapes and peaches, which offer a mix of vitamins, fiber, and protective plant chemicals. General tips. Eat at least 5 servings of vegetables and 2 servings of fruit every day. Include many types and colors for a good mix of cancer-fighting nutrients. Cook, steam, or eat raw for variety, but salads and raw veggies are especially protective. By choosing more of these vegetables and fruits each day, you support your body's natural defenses and lower your risk of many cancers. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments section. See you in the next video.